Hey everybody, welcome. This is Jason from Vitality Therapy. I'm here today with Amy Samsonovitch. She's going to do a talk here next week. First off, I'm really happy to do my first Facebook Live. Finally, Sean and Kev decided to give it up a little bit for a while, and there's been some overwhelming demand to get someone else in, some fresh blood. So thanks, Amy, for joining us today.
My pleasure. Thanks for having me.
So for those of you who don't know, Amy will be here next week. She's going to do a seminar on the 5th of December. On a program she's created called Embody. So first of all, we're going to get a little background on Amy. So why don't you just share with us a little bit about yourself?
For sure. So personally, I'm married to Joel Stutman, and we have 3 wonderful kids. Professionally, I've been working in the field of health and wellness for, almost 20 years. I'm a certified yoga teacher, certified personal trainer, and I'm pursuing ongoing certifications in mindfulness meditation, in addition to the LDOA method.
Nice. And
I have a degree from Concordia University.
Nice. Very nice. Good. So what inspired you to start this information session? What was the idea behind Embody?
Yeah. So about 2 years ago, I suffered 2 concussions back to back from snowboarding.
Okay.
And my life was completely a mess. Living in the dark, wasn't able to drive, couldn't read, couldn't write, couldn't interact with kids, couldn't be around people, headaches, vertigo, nausea. And it was in that period, that very dark period, that I recognized that there was something missing within the medical system, whereby a resource wasn't available for those that have to then go home and learn how to heal by themselves.
Absolutely.
We can go to our osteo appointments, we can go to our physio appointments, acupuncture, massage, whatever the case, but then...
There's a lot of time at home by yourself, right? There's a lot of time in between stuff.
But then you have to go home.
Absolutely.
And you need to figure out what to do with your headspace. And that's where things can get tricky, and that's where it can get kind of messy, you know?
For sure. Actually, I have to talk a lot of times with my patients that it can be concussions or it can be anything. And like, say, a bad motor vehicle accident or some sort of bigger injury where I always describe it almost like like an invasion of privacy. Mm-hmm. Like your life is going on with your kids and your work and everything is fine, and then it just stops. And it's really difficult for that to happen, obviously, right? So you have the physical pain, the emotional pain, but then there can be depression. There can be many things that come from that because life just stops as you know it, and there's not this definitive timeline when you're going to start feeling better.
That's right.
And that's pretty tough.
And that's where Embody came out of, because I had the experience already within the physical component of health and wellness. Mm-hmm. I taught yoga, but I hadn't delved deeply enough into meditation and mindfulness, and that's where that studying came about. And little by little, I started to incorporate this piece of mindfulness and self-compassion and develop the program Embody out of that. So it's a combination of learning how to breathe, because that is right under our noses, and very often we don't tap into that system at
Absolutely.
all.
Mm-hmm.
That awareness piece is not necessarily there, and so I teach people how to become more aware of where their breath might lie, whether it's low or it's high, and how to learn techniques to bring you back to the moment using your breath.
Okay.
The movement piece is dependent on each person or dependent on the group.
Okay.
Where it could be either yoga, or we can incorporate stretching, or even isometric contraction, or incorporate weightlifting. And then at the end, we seal the whole practice with meditation, and we'll use visualization, or we'll use a technique that could work beneficially, specifically for that group. So it is very individualized in that sense.
Okay, and overall, I guess we didn't really mention, I think this is mostly geared towards stress and anxiety, right? That's what you've geared the program towards. Yeah. So it's crazy how things like that overlap. Like, I think the program honestly sounds amazing, and we use parts of that. You remember, I'm sure we've used some parts of that here. Like, I always talk to people with the diaphragm. I mean, there's probably not any patients that we don't address the thoracic diaphragm in. For people who don't know, your diaphragm contracts about 22,000 times a day, right? So that's a lot, and there's obviously proper ways of using your diaphragm and improper ways. And we always think of it, obviously, as like, this is what lets us breathe, and it transports oxygen, which is obviously its main focus, but it has such a big thing with stress and anxiety. From any kind of emotional or physical trauma where there's stress or anxiety present, the diaphragm just stops moving properly, and it really why I think you've chosen to use that as one of your tools is the impact it has on our nervous system, right? So people who are in stress and anxiety, they have this heightened sensitivity, this heightened sympathetic system, if you will, and normally our breathing is controlled by our parasympathetic system. So by training the diaphragm and re-educating and learning how to use it properly, that's how people can help to restore some balance within the nervous system. So it takes them out of that fight or flight stage and allows them to just kind of come down to a steadier state, which can then comes out with less pain, better functioning. There's many other things that comes from that. Yeah. So that's great. Moving with awareness too. I mean, that's the awareness part is huge. Most people, unfortunately aren't very aware of how they move, right? And there's major impacts on that. They're either they don't know how they move, or they don't know the consequences of maybe certain positions they get in and how that affects their overall health. So I think your three steps are fantastic. In the mind, we all know how important the mind can be or is in outlook and the negative thinking or getting trapped in certain things. I think that's it's a really cool.
And in my personal experience, I just wanted to get better. And that's what a lot of people will say coming out of or being in a chronic condition. Whether you're in a chronic condition from an accident or from an illness, or whether you're in a chronic state of stress, they're all grouped under that same area of that post-traumatic stress disorder. And that's where that cortisol is constantly being, sent off. And when you're in that fight or flight, it's very hard to know how to bring all that back to a level of ease and comfort.
Absolutely.
And that's exactly where I was at one point, where there was this struggle in my mind of, I just want to get better, and that was creating more stress in my body.
Okay.
And wasn't allowing for a proper healing environment, because the mind speaks to the body and the body speaks to the mind.
Yeah, absolutely.
They're 100% interconnected.
Absolutely. And so is your life that you're living at that time, right? So at the same time, you're still trying to be a mother, you're still trying to be a wife, still trying to be everything at life, and you just have these obstacles in your way. So I guess then your ideal, if you had to describe your ideal client, someone who would benefit from your program, what are you looking at that way? Like, who do you see?
We're talking anyone. And we're talking somebody who works 2 long hours and is just overburdened with stress and doesn't realize why they have that neck pain constantly or that lower back pain. How the mind interprets stress, it doesn't see itself differently from something that's happening in your life to an accident. So it'll just over time sit within the muscles and then create tension.
Yep.
Therefore, that person's an ideal candidate, but so is somebody who unfortunately has been suffering with chronic pain or illness for a very long time as well, and learning how to break it down and simplify, where you're at and how to regain your quality of life.
I agree. Yeah, the chronic state is where that's the stuff to get out of, right? So, great, fantastic. So, how do you run your program? Are you looking at, is this something you do on a one-to-one basis? Is this something more that you do in a small group environment? Like, how do you work?
Well, I work it both ways.
Okay.
Right now, in the group setting, I work with all 3 of the components in a more broad sense, and offering opportunity for growth as the sessions continue. So, for example, if it's 6 to 8 week section, we have a goal for that 6 to 8 week session, and then we move forward from that. Whereas one-on-one, it is more individualized, because I can work with the person on an individual level at a very different level.
And how often are you seeing them? Like how many times? Is it once a week? Is it several times a week?
Once a week for individual treatment, planning, and sometimes twice a week for the group sessions.
Great. Yeah. Fantastic. So how do people find out about your services? Like, do you have a website started? Are you on social media? How do they find out more about your
I'm on social media. I'm on LinkedIn, Amy Samsonovitch. I'm sure that they can find the spelling of the last name on your website.
There you go.
Just
Perfect.
in case. As well as I have a Facebook profile too.
Okay.
And or they can call the Vitality Clinic, and they can get in touch with me that way as well.
Perfect. Yeah. So to recap, everyone, stress, anxiety people, anyone who's really feeling overwhelmed lately, it's a big time of year for that as well, with the holiday season approaching. Look it up. It's the same. It's just different principles, but putting them all together. You've got to go look at your mind, your body, and your breathing, and incorporate it all together. Amy's going to offer a complimentary session this coming week, December the 5th at 7 p.m. here at Vitality. I encourage everyone to come out. and see if there's something that might interest you, see if there's something that you think, you know what, I can use that in my life and move forward.
Yeah.
So any closing thoughts you'd like to say?
I mean, I'm open to all. I really work within each person's individual needs, and it's beneficial to everyone.
Great.
Yeah.
All right. So thanks everyone for tuning in this week again. And if you can, we've posted before. We want to hear your input. Anything that you want to see come up, any topics you'd like covered. Someone came up with one last week. They want to learn more about sleep and melatonin production. So next Friday, it's going to be on sleep. But keep the comments coming. Keep the ideas coming, and we'll see you back next week. Take care, everyone. Have a great week.
Thanks so much.